Okay, go ahead.
Okay, so today we're going to talk about the digestive system because that's something that is in every species and we all need to understand. It's very important to understand how it works. Oh, can you go back one? Perfect. Okay, so we're going to talk about two main types of digestive systems. There are monogastrics, which is over here on the left, and ruminants, which is right here. Monogastric basically means single-chambered stomach. You can go to the next slide. And that's what we are. We are monogastric, so are dogs and pigs and cats. Next. It's going to start in the mouth. That's where everything starts. You're going to eat your food. And there's two types of digestion occurring. There's mechanical and enzymatic. So mechanical is the physical chewing of your food, and then enzymatic is the enzymes in your saliva that are going to break down the starch before you swallow it. The food is going to travel through the esophagus into the stomach. This is the inside of the stomach. So if you look at it, the gross anatomy of it, gross anatomy basically means what you can see without help of a microscope. So you can see that it's like smooth and it self-creates its own mucus to protect the lining. The microscopic anatomy of the stomach lining are tiny little gastric pits that produce that hydrochloric acid. So after it's in there, it'll go into the small intestine. Next slide. And this is the inside of the small intestine. It has little finger-like projections called villi that increase the surface area to absorb more nutrients and water. Next. And then it will go into the small or large intestine, which has a different lining. It's more rough. And basically what occurs here is some water absorption, but mainly it is where the feces is stored and formed before it exits the body via the colon and anus. Next. Ruminants are a little bit different. It starts the same and it ends the same, but ruminant basically means it's a four-chambered stomach. The biggest misconception about ruminants is that they have four stomachs. They do not have four stomachs. They have one stomach with four chambers. That's like saying we have four hearts. We have one heart with four chambers. Some examples of ruminants would be goats, cows, and deer. So it's going to start in the mouth just like we did over there. It's going to travel through the esophagus and into the first part, which is called the rumen. Next slide. The inside of the rumen has villi, just like we did over here in the small intestine. And what occurs in the rumen is bacterial breakdown of food. So there's going to be microbes and protozoa floating around in the rumen. And then it will go into the reticulum next. The reticulum is known for having a honeycomb-like structure. And this is where more dense material falls into. It's lower in the body, so if your goat or cow eats a bolt, that's where it's going to be located. And then after that, it will travel into the omasum, which is a smaller part, and that's where the water is absorbed. It's also called the butcher's Bible, so it takes the food and compresses it to get all the water out. And then it will go into the abomasum, which is also called the true stomach. So that's more like our stomach in the monogastric side of things. It has the hydrochloric acid and the other gastric enzymes in it. And then it will go into the small intestine, just like it did before, and then into the large, and then it will exit the body via the colon and anus. Next, we're going to talk about some diseases and conditions in monogastrics. The first one being internal parasites. This is something that's in all animals, whether it's external like ticks or fleas, or internal like coccidia, barber worms, hookworms, roundworms, and tapeworms. A parasite is something that invades a host, so like us, or a cow or a dog, for the benefit of themselves, because they can't live on their own, so they use the host. So some symptoms of an animal with an internal parasite would be diarrhea, weakness, fever, anemia, which basically means they have a very low red blood cell count. And the easiest way to check that is to look on the inside of their eyelid, and if that's not red or a bright pink, and if it's more white or really light pink, it means they have a low red blood cell count. Dehydration is also a symptom, as well as a very foul-smelling stool, and death can be a cause of internal parasites. Treatment for this would be making sure everything's clean, making sure their stalls are cleaned out, and pasture rotation, which is basically the idea of your barns here, and you have different pastures, and they're blocked off. If you have an infestation of parasites, you start here, and then the next day you'll travel here, or the next week, and then you'll move them over here, so that whatever's in the ground here hopefully dies out before they get back around. Does that make sense? And can you go to the next slide, please? Now we're going to talk about diarrhea. Diarrhea isn't really a disease, it's more of a symptom. So the body's way of flushing out a foreign body or a pathogen is through diarrhea. It's the fastest way for our body to make it exit other than vomiting. So when you have an animal with diarrhea, it's good to look at what's causing it. Is it an internal parasite? Is it a fever? So the best way to treat that is clean, fresh water, because if they're not getting enough water, they can actually die of dehydration because your intestinal tract is pulling all of the water from your body and your cells to push that out, so it can dehydrate you to the extent of killing you. Next. Now we're going to talk about some diseases and conditions in ruminants. First one being bloat. This is extremely common, and it's just an excessive accumulation of gas in the rumen, which is right here on their left side of the body. So the best way to notice that is look at a giant bump on this side, and they'll usually appear really like wobbly, and they'll grind their teeth because it's uncomfortable. Some of them get a fever. A very nice home remedy for that is just putting baking soda in their food, and they eat that, and that helps. In very critical situations, you can insert an open syringe, so taking the plunger out of the back and putting it right into the rumen, and it releases all the gas. That's usually only used in really serious situations, though. Ketosis is a metabolic disorder which is when the animal is deprived of carbohydrates. This occurs a lot in pregnant does or cows because they're not eating just for one but for two. So if they're not getting enough to eat, that can be a big problem. Depression, little to no appetite, which kind of counteracts what you're trying to fix. Grinding teeth, poor coordination, weakness, coma, or death are all symptoms of this. Treatment, it's harder to treat it than it is to prevent it. So when you have a pregnant doe or calf, it's important that they're getting enough water, they're getting enough food, they're getting all those nutrients that they need. But treatment would be insulin, electrolytes, and vitamin D. Gastrointestinal cannulation. This is pretty interesting. If anyone's ever gotten to stick their arm in a cow, it's not something you get to do every day. It's pretty cool. The purpose of it is mostly educational. What they do is they will make an incision right here in the cow, and it's about 7 to 10 inches long, so just the diameter of this cannula. And they will make the incision there, and then they will get the rumen, and they'll make that same incision there. They'll pull the rumen up and attach it to that external layer, so that when you're looking in the hole that you've created, you're looking right into the rumen. So you're not seeing the rest of the abdomen. And then they will take the cannula and they will take sturdier sutures and suture that to the skin, so it's permanently placed in the cow's side. So this is something that when it's put in this cow is retired, she's through her reproductive ages, and it's gonna stay there forever. And it has this plug that goes on it, so that just pops right in, and it will make a seal so nothing can come in or out, and that pops right out, and you're able to stick your entire arm in, which is kind of cool. So yeah, next. That's it. Any questions?